My name is Darren Goodwin. I'm the Operations Officer in charge of the paramedics and doctors here in Devon. And we're going to be working today with the Fire and Rescue Service and the police. So what we're going to do very shortly is we're going to reveal an incident, and we're going to talk through what happens from a police perspective, from a fire perspective, and from the air ambulance perspective. I am going to ask you to use some artistic license in this. So the emergency services now are getting some calls. They've gone through to the police service that a motorcyclist has collided with a car. PC Ollie Taylor has arrived. I'm going to hand over to him and he'll just explain what he does when he's first on scene at the incident.
Yeah, good afternoon. First on scene of a serious road traffic collision. First thing I'm going to be doing is updating my control room with exactly what it is I've got. Yeah, control from Tango 27 receiving.
Victor from Tango 27, go ahead.
Yeah, confirm code 6 RTC, serious collision here, motorcycle versus car. Motorcyclist is currently trapped. I require ambulance, fire, and I'll look for a suitable landing site for their ambulance as well. I'll come back to you with further details in just a moment. 27.
Tango 27, thank you, all noted. We're calling fire and ambulance for you.
Yeah, lovely, thank you. My first job now is going to be, because I'm first on scene, I'm going to see if I can do any first aid. Can you hear me? Can you hear me? It's the police. Can you hear me? Casualty here appears to be unconscious. I'm hoping the ambulance is going to be en route fairly soon. Speak to the driver quickly as well. Can you hear me? Yeah, first aid's en route, all right? I'll come and see you in a second. My priority at the moment is going to be the motorcyclist. I'm also going to think about now looking at somewhere suitable I can put the air ambulance down. We're going to likely to need the air ambulance for this. My control room's aware of that. They'll be getting on to the other emergency services on my behalf. My role in all this is going to be the investigation. I want to know what's happened here. Is somebody at fault? If they are, they're going to have to answer to that, as well as getting other specialist resources here. My forensic collision investigator and other colleagues who are going to come and help me investigate this. Thankfully, always a good sign for us, fire service turning up, they can then take over and come and support the casualties.
Thank you, Ollie. My name's Matt Goodman from Devon and Somerset Fire and Rescue Service. With us today is our local resources from Topsham and Red Watch at Middlemore Fire Station. So our first role in such a scenario will be very similar to Ollie initially, in that we'll be carrying out an assessment of both the casualties and some of the other hazards that might be represented. So removing the motorcycle is also a good idea. So we call this phase of our response scene safety and assessment. So it incorporates the vehicles, the casualties, and the general environment. We're very conscious of the time from the point at which the incident has occurred to the point at which the casualties will be handed over to what we call definitive care, which is the hospitals. So we operate within a risk critical and time critical environment. So what we try and undertake is something called simultaneous activity. That's both activities being undertaken by the Fire and Rescue Service, but also the police and our colleagues in the ambulance service. So we'll have physical and medical rescue. Whilst we're assessing the casualty and the vehicles, other crew members will be establishing what we call an equipment dump. So at this point, from a fire point of view, we're always very pleased to see our colleagues from South West Ambulance Service Trust. And whilst our firefighters are trained in trauma care, what we'll now be doing is providing a basic handover regarding the patient's conditions to our colleagues from South West Ambulance Service. And that'll enable us to undertake that physical and medical rescue, whereby from a fire point of view we'll be looking at the technical rescue, and from an ambulance point of view we'll be looking at the medical rescue.
As you can see from the screen, at the same time our control room is scrambling the helicopters, and because there are two patients here, and because of the resources we have in Devon, we're able to mobilise both our helicopters to the scene, which means both of these patients can not only receive critical care, but they can both be taken to the most appropriate treatment centres for them. The paramedics from the ambulance service have arrived on scene, and they are doing their initial assessment of the patients whilst they're awaiting the arrival of the two helicopters. And the first of the air ambulance teams who are arriving, as you notice, there are 3 clinicians on the team, 2 critical care paramedics and one of our critical care doctors, which means we can bring the hospital to the roadside. Working together with the fire incident commander, we're coming up with a plan of action. And what we'll do is we'll look at all of the patients and decide which is the most time critical patient and which needs to be seen first and receive the most high level care of intervention. The motorcyclist unfortunately has hit the side of the car, and as you can see is trapped underneath the vehicle. The critical care paramedics are now working with the fire brigade to formulate a plan of how to remove them from underneath the car.
So whilst that plan is being drawn up, other activity that the Fire and Rescue Service will be doing is essentially stabilising the vehicle. So in our world we call that a safe working platform, whereby we'll use dedicated chocks and wedges, and the idea of that is to take all movement out of the vehicles. If you imagine with the suspension of the vehicles, what we want to do is make sure that they don't move at all, particularly where we've got people that may have injuries to their neck or spine. So we'll create that safe working platform, which will also enable us to make access into the vehicle, and that will enable all the responders to undertake a more thorough assessment of our patient. Within this scenario, where we've got a patient who is actually underneath the vehicle, we're just using some of our hydraulic rescue equipment just to lift the vehicle very slightly, and in doing so we can release the pressure off of the motorcyclist, and that motorcyclist is our priority, and we'll then undertake the plan that's been agreed between all the responders to remove that patient from the hazardous area.
So our critical care paramedic Mark and Dr. are working with the motorcyclist at the moment, and we've identified that he is the most time critical of the patients. So the idea is to work closely with the fire brigade to create some space so we can remove the patient and get them into an area which we can work on. This patient has hit his head quite badly when he hit the side of the vehicle, and we've identified that his serious head injury requires treatment at the Regional Neurological Centre and the Major Trauma Centre, which is based in Derriford, down in Plymouth. And as many as you know, and if you've driven from Plymouth this morning, the roads are very wet and the journey would take a reasonable amount of time. But by flying them by air, we'll be at Plymouth within 15 minutes. Motorcyclists come out, and we're now going to start some treatment. And what we're aiming to do is to provide the same level of care that's available in the emergency department at Derriford Hospital at the roadside. Patients that have serious head injuries are very, very time critical. We need to get them quickly to definitive care, and the best way to do that in cases with patients with head injuries is to give them an anaesthetic at the roadside. So the team are preparing the patient now, and we'll move them in a moment onto the stretcher, where the team will drill and practice daily for this scenario. We'll move them onto the bed and we'll take over the patient's breathing and help with their blood pressure management so that they can be moved quickly to the centre in Plymouth. Our second team arrive, 2 critical care paramedics, taking a handover from our other paramedic called Kate. And they've got a more tricky job in this case at the moment, as they're going to have to work with the fire brigade to extract the patient from the vehicle. So once the motorcyclist has been removed, they'll work hand in hand with the fire brigade to do so.
So again, to enable us to reduce the amount of time between the point at which the incident has occurred to delivery of the patients to that definitive care, we will continue to undertake that simultaneous physical and medical rescue. So we've now got some people inside the car. They'll be supporting the patient from the point of view of any risk to neck or spinal injuries, whilst further assessments are being made by our colleagues from the Air Ambulance and South West Ambulance Service. Now we've got a basic saying: we make the whole fit the casualty, not the casualty fit the whole. So what we'll be undertaking soon is something that we call space creation and full access. So it's a very systematic process that we follow, and you can apply that systematic process pretty much to any incident that we go to involving vehicles. Now, whilst we've made a plan, that's always subject to change. These situations are always fairly dynamic. So we'll be waiting for confirmation from our medical colleagues that it's safe in and around the vehicle to actually start some of that space creation, at which point we'll break or remove glass. If we break it, it will be controlled. If we remove it, that's always the safest option.
So now we've got 2 teams working very closely together to treat both the patients. The motorcyclist has had all their clothes removed, which might sound odd, but we need to find out all of their injuries and make sure we don't miss anything at the scene. And currently we're applying a binder to the pelvis, so if the pelvis was fractured, it would hold the fracture in place. And very shortly, the crew treating the motorcyclist are going to move him onto a stretcher so that they can perform the pre-hospital anaesthetic that he needs. Meanwhile, Nigel and Nigel are working hard with the patient inside the car. And as specialist paramedics in critical care, they've got a large skill set and are going to give some really powerful drugs to this patient shortly when we move him from the car to make his journey much better. And these drugs are very, very strong painkillers, only available to the specialist paramedics in Devon that work on the air ambulance. And what these drugs enable us to do is to manage the patient's pain really well, but they also make the patient forget what's happened. So if you're experiencing a traumatic event, it's a really good drug to have.
where you get a multi-agency response to an incident such as this, each agency needs to be mindful of the priorities of the other agency that's present. So, for example, whilst we've got a lot of activity underway and clearly the priority is the patients, that is absolutely clear. One thing that we will all be mindful of is the fact that after we've dealt with the immediate requirements of the incident, there will inevitably be some form of investigation. So to support the police in making sure that the evidence is preserved by as much as is reasonably practicable, we will just be conscious of not disturbing the immediate area any more than is absolutely necessary.
The crews have now made some space. They're moving the patient away from the incident, somewhere quiet, where they can perform the pre-hospital anaesthetic. Unfortunately for this motorcyclist, he's bleeding into his brain. And the brain and the skull don't allow for expansion very well, so this patient's really sick. And by giving him an anaesthetic, it means we can control his breathing, give him some drugs to stop the swelling within the brain, and very quickly move him to the neurological centre. The ability to put people to sleep with an anaesthetic pre-hospitally in Devon is only done by us on the Devon Air Ambulance. It's something we train daily for, and it's not without risk, but our daily training, simulation and the high levels of education that the crew go through ensure that this risk is minimised. We need to do a number of procedures very quickly, making sure we've got drips that go into the patient so that we can give them drugs. Make sure that we've got our equipment all to hand. And as you can see, Dr. Kate is now drawing up some anaesthetic drugs, which she'll use to put the patient to sleep very shortly. To the right of the patient, you can see Kate, one of our critical care paramedics, preparing all the equipment ready for the procedure. Again, this is something we train for day in, day out. It's second nature to us. But we've taken our advice from the aviation world and we use a checklist every time we do this to ensure that we don't forget any vital parts of equipment or drugs that need to be used during the procedure. Now is the time where we ask everybody around the patient to be really quiet so that we can do this procedure safely and without interruption. Kate is now talking through the checklist, ensuring that all the specialist equipment is ready and that nothing's missing. And at the right time, the drugs will be given to the patient. And about a minute later, the patient will drift off to sleep and we'll pass a tube down into their airways. And we're then going to breathe for them for the rest of their journey to hospital.
From a fire perspective, something that I find pretty fascinating is the advances in the amount of medical care that patients receive actually at the incident. And we've seen a marked change in that level of care and support over the last few years. And a lot of that knowledge has been brought back from the battlefield in Afghanistan and places like that. and it's truly inspirational to watch them work. So again, from a fire point of view, if we turn our attention to the car, again working on that basic principle that we're going to make the whole fit the casualty rather than the casualty fit the whole. We've created that safe working platform. We've assessed the vehicle by way of any glass that needs to be controlled either through removal or breakage. We're doing something called peel and reveal, so we're removing some of the plastic trim and rubber trim from around the doors and other openings of the vehicle. And the reason we do that is inevitably the manufacturing companies that produce all these vehicles strive to improve the cars that we have on the roads, which is a real challenge for us in the fire and rescue service. So things like airbags, fuel lines, traditionally where you'd find them in fairly obvious places, now they can be in places where you'd least expect them. So some of the expensive Mercedes and things have got up to 18 airbags. So as we're cutting or removing parts of a car, we need to know where all of those airbags and fuel lines are, so that we don't get an uncontrolled release of either fuel or an airbag. So we do that by peeling and revealing, removing the plastic trim. Thankfully, the manufacturers mark underneath that fascia where the airbags are, and we'll carry information on our fire engines as well for each type of vehicle, for each year it is manufactured, so that we can look at that crash data, which just looks like a map of a car really, and we can see where all of those hazards and risks exist, so that we don't accidentally activate any of them.
It might look like we're just stood doing very little. Yeah, I see some nods of heads. That's not actually the case. At this point, we'll be liaising with our colleagues from both fire and the ambulance service. Our priority now is to know who we've got involved in this collision, who are the people involved, because actually we might well have to go and knock on a door, advise somebody that a loved one's been involved in a collision. I'll be looking to find out where the casualties are being taken. So if it's a serious casualty, then potentially one of the trauma centres. Derriford is obviously the nearest one to here. I'll look to make sure we've got an officer goes to Derriford to then get updates on the casualty's condition, start to think about letting family members know what's happened, stuff like that. But actually our job really starts once the fire service and the paramedics have finished. Preservation of life is the #1 priority in cases like this, which is why we stand back, let the experts do what they do best. Our job in the investigation will start once a casualty has been extracted from the vehicles and they've been on their way to hospital. We can then have the scene to ourselves, keep the scene shut down. Our forensic collision investigators, in the example of a serious collision such as this one here, they would look to gather every bit of evidence that we can. So they would scour the scene end to end to be able to gather all the physical evidence. They'll be looking for marks on the road. They'll be looking for tyre marks, skid marks. They'll be looking for debris, all those bits and pieces that they can then gather to provide the reports that we need to be able to establish what happened. Because at the end of the day, we need to know what happened here. Is somebody at fault? If they are, then they will be obviously looking at having to answer that, potentially in a court of law. So whilst we haven't got a huge amount to do for a minute, we'll be looking for witnesses. So has anybody witnessed a collision? You know, we'll be looking at putting out media appeals, things like how long's the road going to be closed for, all that sort of thing. So there's an awful lot of stuff as the police service will be doing behind the scenes while the main activity here on scene is going on between our other colleagues.
The motorcyclist has left scene now and is flying to Derriford, where we're providing the same level of care that he would get in the emergency department in their resuscitation room. And what that does, by bringing the resuscitation room to the roadside, it means that these patients have got a much higher chance of survival. In some cases, their chance of survival is increased by 40%.
So the particular technique that Red Watch and Toxteth Fire Station are showing us today is something called a B-post rip. So what we're essentially trying to do is remove the side of the car to create the maximum space with the minimum of cuts. And in doing so, we'll create full access so that a full assessment can be made of the patient, their medical condition, and also their injuries. And then we can facilitate the final part of the technical rescue through the removal of the patient from the inside of the car to outside. So from a fire point of view, we have two types of entrapment. One is where they're physically trapped, whereby they're unable to remove themselves from the vehicle because the vehicle has been damaged to such an extent that it's restricting their ability to move. Or a medical entrapment, whereby it's actually the injuries that the patient has sustained, which means that we cannot simply remove them from the car. And as such, we would still need to undertake space creations such as this example so that we can still safely remove the patient. So there we can see that the rear door and the front door and the post that normally supports the two have all been removed in one clean and tidy process. What the firefighters are doing now is we're accepting that, having removed the side of the car, there are some pieces of metal which, when we're all task focused in supporting the needs of the patient, then we as responders can forget sometimes that those hazards are present, so we cover them up and we remove the hazard. It's as simple as that, and then no one needs to worry about them.
So Nigel's just got into the car, as you can see, and in his hand he has a selection of drugs that he's going to give the patient to give them some really strong painkillers to help them out of the vehicle. And as they've been assessing the patient, they've probably found with this sort of injury that they've got injuries to their legs and their arms. And as he's removed in a moment, or as she's removed, sorry, in a moment, we'll see the crew working very quickly to package the patient, remove their outer clothes, give a full assessment to find out what their injuries are, splint, any fractures, package them on the stretcher and get them away to hospital as quickly as possible. We're using a rigid board here to put under the patient's bottom, and with the help of the fire brigade we'll gently turn the patient and slide them out of the vehicle onto the stretcher. All the time we'll be holding the patient's head to ensure we don't have too much movement, and being mindful of any injuries that we find as we move them out of the car. This is where teamwork's very important. As you can see, Nigel's talking with all his colleagues, some from the South West Ambulance Service, some from the Fire Service, to ensure that we quickly and smoothly extract the patient with the least amount of pain and damage to them. This can be the most distressing part for the patient, extracting them from the vehicle. But as I mentioned earlier, Nigel's already given some really powerful painkillers that will not only help with the pain, but help the patient forget the incident afterwards. And now is the time for us to work quickly to get the patient packaged and away to hospital. So we're going to hold the patient's head. One of our fire colleagues is helping with that. And next thing we're going to do is going to start removing the clothes to ensure that we haven't missed any injuries underneath. It's a really good example of our multidisciplinary working and how well the teams work together, all focused on getting the best patient care. Nigel just now checks the whole body, top to toe, to identify any injuries that are there, and then we can quickly apply treatment, whether that be a binder to the pelvis, which is what Kate is preparing to the left of the patient, or whether it's splinting fractures using a traction splint. We try to do many things at once, so as the stretcher goes in on the left-hand side of the patient, we're also applying the splints at the same time, so it reduces the amount of movement. So if the patient is bleeding, the least movement we can do to them, the better. It stops that bleeding from getting worse and makes sure any clots that are in the pelvis or in the chest remain there. We haven't mentioned the pilots in the scenario yet. What they do for us at this time, the pilots generally keep people away from the scene, talk to families that turn up to see the helicopter, but most importantly, they're helping us plan our route. Can they get us to the major trauma centre? If we can't get to Plymouth Hospital because it's in fog or it's raining, can they get us to the next major trauma centre in Bristol? And should a child be involved, they'd also be looking at the availability of the Children's Hospital in Bristol and planning the route and ensuring they've got enough fuel to get us there quickly. During his assessment, Nigel's found that this lady's got a fracture to her right leg, and Kate is now preparing a specialist splint which will help to reduce the fracture, put it back to its normal shape. And the advantage of this is it helps the patient make a shorter recovery, gets them back to home and work much quicker by doing this at the scene and not waiting until we get to hospital. Nigel's stepping back from the patient, and what he's doing is alerting the trauma centre in Plymouth, telling them that they've got a patient who's been severely injured in the car accident. And the relationship we have with the hospital means that we can ask for specific treatments or things like blood to be available when we arrive in the department. And all this means that the patient gets a much quicker treatment. Once the splint's applied to the leg, we try to keep the patient as warm as possible, and we're now going to move them away to the helicopter. Not literally. The rigid board we use to extract the patient from the car has been removed because that's very uncomfortable. And the stretcher she's on at the moment has a little gap all the way down the back, which means it's a lot more comfortable for the patient in flight. Some reassurance to the patient just before we move to the helicopter. It's very, very noisy in the back of the helicopter when we start, and it doesn't always lend itself to a long conversation in the back of the helicopter, so reassurance before we leave is really important. I'll just wrap it up and then you've got to do it. Thank you very much. I'd like to thank everybody that's been here today and helped us with this demonstration. It's really important, the relationships we have with the fire brigade and the police, and that's shown here today. And what we're going to ask the fire brigade to do just now, just before we take any questions, is they're going to take the roof off the car just so you can see some more of their work and the things that they do should we need to get more access to the car.
That's you, one willing.
Would any of the young guys like to volunteer? Have we got any volunteers who'd like to sit in the car whilst we take the roof off? Would you like to volunteer? Yeah? Come around this way.
That's Toby's son.
Oh, is it?
So just at the point at which it rains again, we're going to take the roof off. So hopefully what the first demonstration is able to show is that it really is a multi-agency response. And we've been calling it the team approach for about 15 years now. And whilst originally we may have used that phrase for purely fire and rescue service activity, the team approach now represents so much more, whereby we work hand in glove with the other blue light services. So it is truly a team approach with that physical and medical rescue. But for the purposes of just providing you with some more practical demonstrations of how we can create space with a car, we're going to undertake what we call a primary roof removal. I suppose in years gone by this would have been our preferred option. It's an excellent way of creating a huge amount of space around a casualty. It makes it very easy to get the patients out of the cars, particularly from things like a manual handling perspective. Might not always be an immediately obvious thing to think about, but moving patients out of cars can put the rescuers in some really awkward positions, particularly if the car has left the road, maybe isn't on its wheels, maybe on its side or on its roof in a ditch. So removing the roof really does give us that aspirational full access. So what we're undertaking at the moment is we're cutting the windscreen. The windscreen is what we call bonded and laminated, so we can't simply take the rubbers from around the outside of the windscreen and take it out. We can't smash it because it's laminated, so there's a clear plastic film within the layers of the glass. So we've got special tools which we use to actually cut through the glass, and we'll cut through the glass at the point at which we're going to actually cut the metalwork. So we'll remove the roof with the glass still intact. However, as we cut the glass, it will produce very small pieces of glass which we have to be conscious of, which is why we were putting some water onto the windscreen. It prevents those very small pieces of glass becoming airborne. The risk there, of course, is once it's airborne, then either the rescuers or the patients can breathe it in. So that's why we use the water on the windscreen. So now we'll move around the vehicle using the hydraulic rescue equipment. What they're using at the moment is something called a pair of dedicated cutters. It's not just the car manufacturers that are improving the cars, but in the fire and rescue service there is always advancement in technology. So we're very lucky now that we've got a replacement program for our hydraulic rescue equipment. It's becoming much more lightweight, although if you're a firefighter you might not think that. And they're also increasingly battery operated, which is a real improvement for two reasons. One, it's much quieter, which reduces the stress to the general environment, which is better for the patient. But it also removes all the cables, which when you're not concentrating can be something that someone can trip over, either a responder or a member of public. So we're still working on the basis of maximum space, minimum cuts. We'll work our way in a logical sense around the vehicle, cutting each of the posts. Of course, as we do so, the vehicle becomes more unstable, particularly the roof. So more firefighters are required to support the roof as we cut through those pillars. The other thing we need to bear in mind is as we take items of the car off and remove them, so the car becomes lighter and moves up on its suspension. So we'll continually reassess the stabilisation of the vehicle, making sure that we've still got that safe working platform. So here comes the last cut. Just a bit of electrical wiring there needed to be removed. So you can see now that the side of the vehicle is removed and the roof. Again, we will cover up all those sharp pieces of metalwork. And I think we should give our patient a big round of applause. They've done really well there. Thank you to our colleagues from the Air Ambulance and South West Ambulance Service, and also to Redwatch Middlemore and Topsham Fire Station.
That, ladies and gentlemen, is bringing us to the end of the demonstration. And I've just got some thank yous that I'd like to make. And as just said, I'd like to thank the Fire and Rescue Service and the police. Without their interaction, this wouldn't happen. But most of all, I think it's really important to thank each and every one of you for coming and your ongoing support to the Air Ambulance. The volunteers and fundraisers keep us doing what we're doing. So thank you very, very much. I hope you enjoy the rest of the day. And we're around and about if you'd like to speak to us and ask us any specific questions.